physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So, the question today, have you torn or strained a ligament in your knee? And we're talk about how to tell.
Yes.
Very common injury with athletic events.
Right.
And we'll talk about how that happens. But there are four main ligaments in your knee.
Yeah, this is pretty clear cut.
Yeah. And the ligaments are strong bands of tissue that connect one bone to another. So we're connecting the tibia to the femur.
Right.
And in the knee, they help stabilize the knee joint too.
Right.
I mean, they're the main thing that does stabilize the knee joint.
I always think of it mechanically. One of them stabilizes from going forward, the tibia, one from backwards, and one right and one left. It's not quite that
and
simple.
also rotations too.
Yeah,
So
I always, anyways.
So common ways the ligaments get strained or stretched or torn or completely torn, again during sports, if you suddenly change direction, like cutting in football, or if you're slowing down quickly.
Sure.
Very common. Also, of course, where you get impact on the knee too.
Sure, yeah, like in an auto accident where your knee smashes into the dashboard. Also, when you put weight in a rotation or weight and the knee goes in, which is part rotation, and there's a combination there. But anyways.
We see it sometimes in women in volleyball where, because a lot of them have the Q angle, the knee is turned in.
Yep.
And they land incorrectly or awkwardly jumping, and they land with the knees in like that.
And basketball has a high incidence.
Could be guys and girls.
Yep.
So, again, we talked about a sudden stop to do it. Pivoting on your knee, like we said, with your foot planted. You know, it's funny, we had a quarterback in Minnesota for our NFL team that he did it.
You got a professional team in Minnesota? Just kidding.
So anyway, he was just, it was non-contact, and you hear that quite often.
Yeah.
I remember a couple of basketball players too that just landed and hyperextended their knee and took their ACL out. So these are some indications that you may have a torn or strained ligament in your knee. Sudden and severe pain. So if you did something and it comes on suddenly, a loud popping or snapping sound. Sometimes people in the crowd can actually say they heard the pop when the knee got hit. Rapid swelling. In the first 24 hours, it swells up like a balloon, like right away. The knee feels loose and unstable.
Right.
You got one of the legs of the stool, four-legged stool that's gone now. It becomes unstable.
I just wanted to say that you could have a partial tear versus a full tear or rupture, and they both have a little bit.
Stretch it even.
Micro tears.
Yep. You're unable to put weight on the joint. It's painful or it gives way. And you have a loss of motion in the knee, and that might be because part of the swelling too. So with these indicators, you probably, if any of those above indicators, you probably should see a physician.
Yeah, get it checked out.
I'm going to go over the test, Brad, real quickly.
Sure.
I don't think anybody can do these on their own. Well, they certainly can't do them on their own. I don't think really you can have somebody doing them to you unless they're trained them, because they're just difficult to do.
Yeah, there's that one actually that just came out that we did a video on.
Yeah, that's right.
That one is a little easier, but we'll do the ones that are have historically been common.
Right. You want a pill, Brad?
Oh, yes. Thank you, Bob. Now I know that you're concerned about my comfort level.
That's right. So we'll look at this leg here. Why don't you roll your pant leg?
Oh, Bob, the legs ain't what they used to be. That's for sure. I'm getting varicose veins and all kinds of stuff. My hair's falling off.
So you're going to start with the knee bent to around 45 degrees, which is right around there. And we're going to take this bone here and pull it forward. And if the ligament, the ACL, anterior cruciate ligament, is doing its job, it's going to prevent me from going forward.
Right.
So here's the joint of the knee. So I actually put my thumbs above it.
Sure.
And I'm going to pull rapidly like this. Now, what I do usually is do it on the knee that we know was not affected.
The good one,
Yeah, so I can get a sense of what it feels like. And then I do it on the knee that's I think that might have an injury.
I
You-
usually
you
sit
feel.
on the foot.
Oh
You do
yeah,
that?
that's right. Yes,
Yeah.
yes. Very
Just
good point.
it kind of locks it down, but
I'm
you
almost
know,
falling off here.
you got to be. I always tell the patient, I'm going to sit on your foot on purpose.
Right.
I'm not doing it
Exactly.
because I'm senile.
Now, if we got that's for the ACL. Now, for the posterior cruciate ligament, the PCL, we're actually going to push down the other way,
Yeah.
like this, to see if it gives way a little bit. Not as common.
Not
don't
near as
don't
common.
find that very often.
Right.
So then now we're going to check the ligaments on the side of the knee.
Yeah.
So if we want to check the knee on the inside of the knee right here, I'm going to bend the knee just slightly here, and I'm going to hold on to the upper thigh here, and I'm going to bring the lower leg in towards the other knee. And if that ligament, oh, I'm sorry, I'm checking the outside of the knee.
Pop quiz time.
Yeah, this is the outside of the knee.
Right.
And I'm checking
Lateral,
varus.
LCL. Yep.
Yep. And then I'm going to push it out the other way.
Again, this is one that it takes practice to
Yep.
understand. So we don't, we're not
And that
expect anybody
would
to
be
do
the
this.
inside of the knee would be laxity or pain. would go on.
Right. Yep.
Sometimes you can, for the outside the ligaments, you can just push along them and go, oh, that's right. It hurts right where the ligament is.
Yeah.
And-
And you have to be pretty familiar with the anatomy, but typically, especially if the person is thin, boy, those ligaments are just right under the
Right.
skin. They're so superficial.
Yeah, if it hurts along the whole joint line here, then something in the joint quite often. But if it hurts just where the ligament is,
Yeah, these are things that we don't expect you to do, as we mentioned. But when
Right.
the doctor or the therapist does it, yeah, at least you'll be familiar with
but
why
it's-
they're doing
yeah,
it.
it's very simple concept here is that, if those ligaments aren't doing their job, it's sloppy.
Right.
The joint's going to be actually, you
Yeah.
can move it. And that's why over time, sometimes you want to have the ligaments repaired, because if they aren't repaired, your knee's going to be sloppy for years and years,
Right,
and it can
right.
start wearing out prematurely.
Yeah,
So
it's kind of interesting. There are people that do not have an ACL. It ruptured and
Right.
they did not get it repaired, and they still can be active, but they really have to make sure their hamstrings are strong to compensate.
I know I have several friends that had ACL
Rupture?
injuries,
Yeah.
but did not have them repaired.
Sure.
So, and one's doing fine. I mean, I don't know how the other one's doing. He was a physical therapist, but the one I just saw, and he's my age. He's 61 years old and has no knee pain, so he did fine with
Yeah,
it. So,
it's a conversation you obviously are going to have with your surgeon or
right.
doctor. Mhm.
Yeah. So, all right. Remember, this video is a part of a series of videos on knee pain. So, if you want to see the entire series, go to bobandbrad.com. Go to the program section. Look for the titles that pertain to you, and those are the ones you can watch.
Right, there'll be 30 or 40 videos on these, but just skim through the titles. You'll pick out the ones by the title and watch it. There's a bonus, a PDF printout that gives you a printout with a nice review of the video. And actually, we got the exercises and tests in there as
we
well.
got the photos in there that'll help.
Right, and if there's any spelling errors or grammar, it's Bob's fault.
That's on me.
Nah, he's did a heck of a job with
And the
doing
people
these.
that are supposed to be editing this. So, the cost is
Nothing, absolutely nothing, not
No.
even your email.
right.
You got people editing these, Bob?
Yeah.
And you didn't ask me? Everybody knows
That's
I'm not an
obvious.
English major.
Yeah. All right. Thanks for watching.